Welcome, I'm Jacqueline Sullivan from the University of Adelaide, and today I'm going to guide you through the basic guidelines of the application of a below-knee back slab. So, in order to do a back slab, you need to require all of the products ahead of time. So, your tape measure, your soft band for padding, your bandaging, your gypsona back slab, your stirrup, and some warm temperature water. You'll also need size 3 Pro Touch stockinette for the leg. Just make sure you measure adequate length, as it does shrink when you put it on the leg. So, for the application of a below-knee back slab, you'll always need an assistant. So your assistant comes and helps you to support the leg, keep the ankle at 90 degrees, and generally make the job a lot easier for you. So we're going to take the tape measure, and the first thing that we will do is we'll measure the length of back slab material that we need. And the measurement goes from behind the knee down to the heel of the foot. If you could just hold that for me, that would be great. Comes up and to the base of the toes. So then once we've measured that out, pop the patient's leg back down, we can then cut our slab material, which we've already pre-done for us today. So the next step is that we actually put on some stockinette. So we're going to pop this on the leg now. So we'll get our assistant to hold the limb up for us. Remember, this patient probably has a fractured ankle. So we just bunch this up and gather it over the foot. Make sure you leave some for over the tops of the toes to fold over. So we pop the stockinette on, leave some at the toe end here to actually fold back. Next we'll take our Pro Touch, and what we will do is we'll measure this leg from the base of the toes to the top of the stockinette and come back down again. So it's like 2 layers, like so. Padding this way gives you extra padding over the bony prominences, which are along the tibia here, your ankle and the heel. So you need to make sure they're adequately padded. We'll just lay that down for a moment, and I'm just going to make a cut up the middle. So the pattern looks like so, sort of long pants. Lay that back down on the front of the leg. Round about there, come down and bring that one around. So what you end up with is 4 layers on the heel, 2 layers already on the ankle and 2 layers on the tibia. We then take our roll, and it's important when you're padding that you don't over pad the limb. So we want to have enough, but we don't want to over pad. And we'll just spiral on down. Come round the foot. Just watch out for where the little toes are. Come back up and make sure you've got adequate to go up to the base of the toes. Come around again and just break off the end. So that's your padding set to go. The next stage is that we will get our back slab and we will apply that to the leg. So we have our back slab ready, and as you can appreciate, it's quite long. So we're going to have to put it into some water. So there comes the complication. How do I get this big long piece of back slab into the water? So a fold like so, and then pop it into the water. Just try not to lose your edges. Put your fingers in between the folds. Pop it very quickly in the water. Let the water drain. Bring it back out. Now as you bring it out, just try and stretch it a little bit. Let the water drain. And I just pop it on the bed. And what I'm wanting to do is get all of that water in through those layers and in through the linear weave of the plaster. You might have to wet some of the pieces if it doesn't quite catch the water. That's okay, we will get there. So now we're ready to go, nice and flat. So we take that up and we bring it around. So if you just move this hand, you just hold by the heel and place this here. So I've got hold of this bit. If you go up to that end and just hold the slab, I'll take this end now. And try to actually get the edges folded down pretty quickly, because it will help to hold on to that slab. So then we start folding the edges in and smoothing it on. You can smooth that on if you like underneath. Any of the pieces that are sticking out like this, which we call dog ears. So we'll bring that up fold out the dog ear and fold it on the outside. So that fold goes on the outside, please not on the inside. Roll this back, like so, making sure that you've got that foot in the position you want. So now my assistant will come round from this side and she will help to maintain that position by putting her hand on the heel and keeping her fingers out, and then by pressing on that one to keep that position. So next we have our stirrup piece, which we will put under the arch of the foot and bring that forward. And what it will do is give us some more plaster along this side of the leg and on the other side as well to prevent rotation. So we're going to just dip that in to the water like so. Let that water drain off. Open it out. Take the stirrup and place it along the side like so. Just smooth it out. Bring that one around under the arch there. Place the one on the other side, and with your assistant we'll smooth that out for you. So note how you have a small opening at the front. That needs to be maintained for swelling, to allow swelling to get out of the limb. Next we'll go the bandage. Just watch your fingers there, that's it. Okay. Piece of tape just to secure it. Then we'll take our cohesive bandage here, and this will help to maintain the bandage's integrity and keep it nice and firm and to reduce presentation to the emergency department because your back slab has become loose after a couple of days. So we'll just pop this on. This goes on with just an actually pulling out technique and a laying down. You only need to capture a little bit of the edge of the previous roll. Like so. Beautiful. And that's your below knee back slab cast. So then we're just checking to make sure the toes are all free and they can feel that. That's good. So then we keep the leg elevated. So in recap, it is important to make sure that you have the right patient, that you have the right back slab for the particular type of fracture, that you give the patient adequate pain relief prior to starting, that you gather an assistant to help you put on the back slab. Make sure you have the correct equipment ready to go. Make sure that you have done a skin check. Also, and neurovascular check prior and post application. And importantly, have a consent verbally from the patient to the application of a back slab. Thank you. So here are some tips on how to get the ankle into the right position. You may have difficulties with this due to swelling, so here we're just going to take you through some simple manoeuvres to get the foot and the ankle into the right position. So we take hold of the patient's leg like so. So be very careful in this. Just rest their leg on the palm of your hand and take the foot and push it forward. That's how it would be done normally. If you're having difficulties in getting this position, what you can do is take a chest board, put it to your chest and just lean in a little bit to the patient, and that will bring that foot up to 90. If this isn't successful, what you can do next is actually take the patient by under the knee here and push the leg forward towards the patient, putting your hand here on the sole of the foot and then pressing forward. Press the leg down. If you then still can't do that, or you're on your own, what you can also do is bring the patient's knee up and bend their knee again and lean in and their foot on your shoulder. So, in recap, it is important to make sure that you have the right patient, that you have the right back slab for the particular type of fracture, that you give the patient adequate pain relief prior to starting, that you gather an assistant to help you put on the back slab. Make sure you have the correct equipment ready to go. Make sure that you have done a skin check. Also, a neurovascular check prior and post application, and importantly, have a consent verbally from the patient to the application of a back slab. Thank you.